1, 2, 3, 4, 5.
Picture yourself at 2 o'clock in the morning. You're fast asleep when all of a sudden you hear a faint cry in the background. As you're waking up, that scream gets louder and louder. You realize it's your infant child. You get up, you do a bottle, and as you go pick him up, you notice that his skin is burning hot and he is sweating profusely. Your child has a fever. What do you do? Are you the type of parent that takes him immediately to the ER in the middle of the night? Or do you give him Tylenol, lower his temperature, and call the doctor in the morning? Different families and different parents do different things. They react differently. But what's the major influence behind parents' motivations, or parents' actions? The Department of General Practice and the Research Unit of General Practice in Copenhagen, Denmark, did a study where they researched the relationship between parents' perspective of symptoms and the probability of a doctor being contacted. Have you ever judged a parent's parenting skills because they didn't act or didn't react the same way you did when your child was sick? Today we're going to talk about this research. We're going to talk about the reason behind this study. We're going to talk about the process and the method. And we're also going to discuss the results that these scientists discovered. But first, let's talk about why this study was conducted. Very little was known about this field. A study like this had never been conducted. And in an academic journal in 2011 titled Infant Symptoms of Illness Assessed by Parents, Impact and Implications, the authors being Erdman, Siersma, Revenlow, and Soderstrom, they talk about how there's 3 influences behind parent motivations. One being the underlying cause or the belief of the underlying cause of the symptom. 2, the parent's behavior towards those symptoms. And 3, whether or not the symptoms were manageable at home. Erdman and his colleagues also talk about how families have other obligations outside home. For example, work. If the parent is not able to take off of work, then the parent is more inclined to attempt home care management of that sickness. Let's talk about now the process and the method of the study. 187 infants between the age of 11 and 14 months were analyzed for 3 months. Documentation was very important in this research. Parents were asked on a daily basis to document the patient's symptoms, whether or not a doctor was contacted and in which manner, and they were asked to rate the patient's condition using a scale, what Erdman and his colleagues defined as parent-rated illness severity. In other words, parents rated their patient's condition as not ill, ill, very ill, or severely ill. So as you see, documentation was very important for the results. Now, what were these results? Well, Erdman and his colleagues discovered that the higher the severity, or the higher the symptom fell in that severity scale, the more likely the doctor was contacted. An example of this was earache. Earache triggered the most immediate doctor contact. They also found out that severity, or when a parent considers something severe, that meant that the parent felt the kid needed medication or that the symptom was not manageable at home. The opposite was also true. They found out that a symptom that was rated low on the scale meant that a doctor was probably not going to be called. An example of this was a cold. Cough, runny nose, diarrhea were symptoms that were rated low and that a doctor was not called among the families. As you go away today, as you walk away, think about what influences you to call your pediatrician. Thanks to the General Practice, the Department of General Practice, and the Department of Research in Denmark, we now have a deeper understanding of why parents act the way they do according to their child's symptoms. We talked about the method and the process. Well, first we talked about why this was important, because no one had ever studied this field. We talked about how documentation was a critical key in the method. And we talked about how the severity rating had a great influence in whether a doctor was called. Next time you are about to tell someone, well, I would have taken my kid to the ER, think about why a parent didn't.
Listening. 1, 2, 3, 4, 5. Five minutes and 30 seconds.
Is that good?